Okay, we are streaming, even though we're not yet meeting.
Hi, hi, it's Marcia. I'm on the phone.
Hi, Marcia,
Sorry.
and I think I see Narina as well on the phone, right?
Yes, hi.
Hi there, and
Hi, Narita.
we also have Kathy and Mike, and Natalie Herto, the new assistant director, and myself, and I see Vanessa coming on the screen. Maria is joining us as soon as possible. She's on her way home to work from home for the rest of the day. And I have not heard from Phil Berardi. I'm going to jump up and close my office door, and I'll be right with you.
I just wanted to apologize in advance. I have another appointment at 1:30, so I'm going to have to jump off at that time.
And I'll apologize in advance. I'm going to mute myself and continue eating a crunchy salad. So,
Do we know if is the phone number Marcia?
Yes.
Oh, hi, Marcia.
Hi, who's this?
Vanessa. I was just trying to see if,
Hi, man.
if we were waiting on
Yeah, how are
anybody
you?
else.
Yeah, I think Narina's on the phone as well.
Yep, that's me here.
Cool.
Yeah.
57 and 45. Gotcha.
Yeah, hope everybody's well.
Same. So, I actually, before we get started, this might not be the ideal time. Maybe Natalie can chime in since Tim is mid-chew. I wanted to just sort of check in general how it's been going at the library, given the changing conditions locally.
I'll take care of that, Natalie. Natalie, I have no doubt could give that report because she's fantastic, but she has worked here for just over 24 hours. So I'll do the
Come
report.
on.
So in general, it's going very well. The staff, I think, you could generally say there are some hardcore maskers that include myself and a bunch of others. And there are a lot of people who are happy to be free of the mask. In general, it seems to be my observation that if you are working with the public or working in a fairly large office space, those people are tending to be masked still, staff members. And then in terms of patrons, I would say probably somewhere around 70% of patrons remain masked. We do have, it might be 65, we do have a number of younger patrons who will tend to be unmasked, but the library is relatively cavernous, even though the foot traffic is better than it was a month ago. It's still very easy to be socially distanced in the library. So a lot of people will wear a mask in and then find a place to sit and study and then, take the mask off. And no incidents or discussions or arguments that I've heard of, so that's good. And we have had just a few reports from our colleagues in Altamont who, it's a very interesting relationship because the service area for the Altamont Free Library is completely surrounded and includes the Guilderland service area. So we are two libraries that share a service area. So a number of patrons have told the staff over at Altamont that they've chosen to come to Altamont instead of Guilderland because we did drop the mask mandate. To my last time I looked at things, there were 4 or 5 Upper Hudson libraries out of 29 that still had a mask mandate of some sort. And in general, it was because their board meeting had not yet come up for this month. So although with no judgment, I do think that some of the people involved at Altamont are very hardcore about masking. So the director at the Directors Association meeting was talking about how he wished that all the libraries making this decision had waited until 2 weeks had elapsed from the last school vacation, and then he might feel more comfortable. But at any rate, I think there's generally a fairly high comfort level among patrons and staff with the position we're in right now. But I would note that Maria has joined us So we started off, Maria, by Vanessa just asking how it's going at the library with everything basically related to COVID. So if you have anything to add, I don't want to unnecessarily put you on the spot, but I might be wrong. Maria and her staff spend more time on the floor with patrons than I do.
I'd say that maybe 60 to 70% of the people now are unmasked. But we also have had some patrons come to us saying that they wish we still had the mask mandate in place. I've had the same experience that Tim just described. But generally speaking, and all the staff, pretty much all of the public service staff, with very few exceptions, wear masks all day still. We just feel far more comfortable doing that.
Sure. And then the current status of programming and the we'll start with programming, and then I wanted to ask about some of the other library spaces.
So we're going in April, we're starting to have some in-person programs, both in both departments, both children's and adult. Not all of them are going to be in person, but I'd say I can't even really give a percentage right now, but we have a couple of programs that started virtual that are series, and they're going to remain virtual till they're finished. We have a couple of other presenters who prefer to do things virtually, and we still have a lot of people signing up for those. I think you're going to see that we're going to adopt a hybrid approach because a lot of people are still really enjoying. A perfect example was last night. We had a program, one of the professional genealogists did a program with 8 people, and it was everybody who had registered, and they all said how happy they were that they didn't have to drive because of the weather last night. So I think we're going to continue to see a combination hybrid approach to that. So programming, a little bit of both starting in April. Today we opened both the meta room and the study rooms. Now we can't open every study room only because some of them are still being used right now to store some of the shelving.
Sure.
Because we've got Accent Furniture there today doing a whole install of some other shelves. But we've opened what we can, and we'll open the others as they become available.
Okay.
And then let me
Maria, it's
jump
Mar-
in.
I'm
Go
sorry.
ahead, Marcia.
Yeah, I just have a question. Is there any thought to giving in the future both virtual and streaming at the same time for people who may have trouble for whatever reason getting to the library?
So
Yeah.
Marcia, we're supposed to have that capability with the technology that's been installed. I'll be honest, nobody knows how to use it, and we all need to get trained. And that training is supposed to at least start, I believe, next Thursday. We're supposed to have a training with the installers, the tech guys. And I anticipate that there's going to be a big learning curve on that for both us and for, outside groups who might want to use it. But yes.
And I would
Thanks.
add to that, and Maria, please correct me if I'm putting words in your mouth, but based on department heads' discussions, I think, and really the industry, I think that everyone expects that the virtues of virtual programming will continue, and that we will need to do both, whether as hybrid or offered one way and or the other way in the future. And like Maria's example about the bad weather last night is a perfect example. So I think it'll continue for now, at least, and probably forever. Related to your question, Vanessa, we still have some problems opening the large meeting rooms and programming rooms because of 2 things: supply chain, and also the fact that we've had these administrative positions vacant for so long. So the Helderberg room, as you know, I think from design steering, is not going to be finished until mid-June, although we're going to start using it. We've used it for blood drives and I think just meetings and blood drives. But, you know, the art shows for the elementary and high school will go on in April and May. There'll be reception for that, more blood drives. I think maybe a couple other things I can't quite remember that are sort of library-wide.
We're doing the boater safety program,
right.
April
Thank you.
13 and 14 in the Helderberg room.
Thanks. So the Helderberg is kind of unfinished, but we're just going to live with it and use it as we can. And then the Westbrook room is essentially finished from a design point of view, except it's got 9 large filing cabinets in it. And we have to find another place for the materials in those files. As I mentioned in a board meeting, there's a new state records retention schedule. We're studying that, trying to figure out what we keep and what we get rid of. But, you know, if we had to, we could move those 9 filing cabinets out tomorrow and just park them somewhere in a back hallway or something and get along. So it's not a huge thing. It's a big project, but if we wanted to have a program in April, we certainly can do that in the Westbrook room. Lastly, the cafe room is sort of in limbo, and, you know, we're soon to start building the counter in that space. And quite a few of our rooms, the Tawacentha room, which is the boardroom, and then the Normanskill room, which is the cafe room, are both full of, for lack of a better term, stuff, I'll say, since we're streaming live, much of which belongs to mainly the electrical contractor, and much of which is stuff that we just haven't figured out where we're going to store once we get those rooms operational. But it's moving in the right direction. And Natalie's here, so everything will be fixed soon.
Okay, thank you for that update. I think it's helpful to hear that as context for some of the discussions that we came together today to have. I really have sort of 2 topics that I think that we should discuss as a committee. One is how we want to address the, I guess you could call it, the silence of the POP plan on masking. And, you know, if we were to enter another situation or phase of this pandemic that required us to return to masking or reevaluate that, our pandemic operations plan doesn't currently give us any direction on that. And so just to avoid confusion or emergency meetings, it seemed like we should maybe talk about the best way to outline the decision-making around that in the POP. And then the second is, you all, I'm sure, aware that the CDC has sort of changed their method of, I don't know, classifying communities. It's no longer around transmission rate. It's a designation that's a 3-step, sort of has 3 levels. And the calculations include some transmission, I believe, but are mostly centered around hospital capacity and intake. And so our most recent revision to the POP had us moving in the direction or aligning our continuation of services to the prior leveling. So one thought that I had that I wanted to present was, I think it could be helpful. It seems that we're entering more of a transition to probably what will be an endemic phase of this virus, to create a continuation of operations plan that's aligned to sort of this high, medium, low community level, but to retain the prior one, because I think it could be, we're kind of straddling this space where the pandemic operations plan is really currently a COVID plan, even though the intention, I think, originally was to develop a plan to guide the library for the current and future pandemics. So I think that there could be some value to retaining sort of the stepped system that we already agreed upon as related to transmission rates, but have some sort of mechanism for which we know, or we sort of say which which leveling system we're going to use. So those were sort of the two topics that I wanted us to discuss today. Was there anything else from the other committee members that you would want to add to that?
I don't think so.
Okay. Guests. Mike, did you have I know you have to go at 1:30. Did you have a topic that you?
I mean, I do have some thoughts. I mean, I think that I am thinking about this just based on what you just suggested in a very kind of different way. You know, I'd be happy to kind of give just my 2 cents, you know, recognizing I'm not on this committee, so I'm not going to ultimately have a vote on how that goes. But my feeling is, you know, that pandemic operation plan was put in place at a much, you know, earlier phase of the pandemic when the situation on the ground was quite different and the nature of the, you know, the nature of the pandemic at that time was quite a bit different. And I think, honestly, I think we're at a point right now, given the major changes in guidance and changes in, you know, law from the state, that we should be trying to turn over as much as possible of this to the discretion of the library administration rather than keeping it as a, you know, board-driven policy matter. So I would be more in favor at this point of more or less, you know, rescinding what we have and basically expressly saying that going forward, it's in the hands of the library administration to use their discretion. And that's not to say that they need to immediately open everything up, you know, or that everything needs to go, you know, back in person or whatever. You know, they could use their discretion, you know, with the input of their staff, to, you know, phase things in and also to rein things back if conditions on the ground change. But I think putting in place, you know, I think the existing plan with the levels, you know, with the different levels based off of the, you know, positivity rate, was a reasonable approach at the time when it was put in place, but now it just doesn't make sense with the current, you know, nature of the pandemic. And if things change going forward in the future, if, you know, a few months from now there's a resurgence of some new variant or something else, I think trying to predict today what makes sense for that new threat, you know, how that's going to play out and what are the relevant factors we should be, you know, considering in our severity, you know, in our response. It's just, I think that's impossible. I don't think there's a way we can reasonably guess now or predict now what are the right criteria to use going forward. So I would be more in favor of expressly giving that discretion to the library administration at this point to make what decisions need to be made to manage this as it goes forward. And if situations do change such that it requires the board to step in and put in, you know, more, you know, specific, you know, policies or whatever, then at that time we could do that. But that's my 2 cents.
Okay. Marcia or Marina, did you have anything, or Kathy, any other?
Hey, I'm so sorry. I was on a call for work and I missed what was being discussed.
That's okay. We were just talking about, I was kind of collecting some topics for us to discuss in the remainder of the call. Was giving some space to Mike because I know he has to leave and he was sharing his opinion. So I was just opening it up for other perspectives. Did you hear my two talking points, Narina, or do you need me to repeat those? It's okay.
I just wanted to comment that
Sure. Go ahead.
I think the plan gave me and Tim some authority on at least the masking question. I don't have any kind of expertise in public health, but you know, I pay attention to what the CDC is doing and that sort of thing. So I don't know if that makes sense for library operations, because that is really the call of the administration in the library. You know, what rooms to open and what programs to have and that sort of thing. So I would just say that that I think I agree with Mike that you know, having a program or opening a room would be up to the administration in the library.
Sure. And so if I can respond, I don't think I wholly disagree, except for that with all due respect, I don't wish to have to convene this group a lot more. And so really my objective would be, I'm not saying that a 3-leveled sort of continuation of services plan would mirror the 5-level one that we have now, but I think we could make some recommendations as a committee as to what sort of action or not lack of action really each of these categories require. Currently, Albany County is still at medium, which means that it's lower, but no, it's not zero risk. And given some of the points that were made earlier by Tim from some of the neighboring communities, we are very early into this relaxation of policies and protocols that we don't really know what's going to come next. And I'm not suggesting that we predict, but I think we can make some decisions about when we'd want to see the return to some protocols, right? I think that we're maybe still too close, at least from my perspective, to completely abandon it. I don't know if the high, medium, low means anything more than, you know, low is normal, all discretion of the library, you know, medium is I don't know. Again, I'm talking off the top of my head. This was something I wanted to discuss with the group. But high, if we were to return to high, would be an indicator that we would expect some category of shift or return to some protocols, right? I don't think it has to mirror the other one, but I am against completely abandoning some sort of structure this early, given that we're only like, I don't even know, a week, not even 2 weeks out of that. So I just wanted to sort of discuss that as a group. And I mean, we can make whatever recommendations we want. It doesn't have to mirror before. It could be sort of a different style. I think that what I have appreciated was a little bit of knowing what would trigger us taking some action. And I think the CDC levels imply that there's still an expectation that varying conditions require some varying response.
This is Marcia. I think that it's too early. I take your points, Vanessa, but I'd like a little bit more time to let this ripen before we start making some changes. I think that one of the hurdles we had was the issue of masks, and as Kathy said, she and Tim had the authority under the plan to make a decision regarding masks. So that was sort of taken care of, at least for now. I like the idea of turning more authority over to the administration, and we may have to make some changes in the POP with respect to the levels, but why don't we wait a while and just see how this shakes out? Because people are coming, in some schools, people are coming back from spring break, and you know, hopefully the trend that we're in now will continue. But I would feel more comfortable if we just, since the masking issue has been taken care of, if we just waited a while and then tried to tweak the POP. Question, Vanessa, were you suggesting that we reinstitute a continuation plan?
So, I mostly agree with what you just said. A couple of points of clarification. The authority that gave Tim and Kathy the ability to make the change to the masking policy, I don't actually think is articulated in the POP. That was an action that happened at a board meeting prior to the revision of the POP. So I agree that they have that, and I think that that is suitable and fine and everything. I was just raising the question of if we wanted to more clearly articulate that authority in the POP, because it's not in there. The other question. Oh, go ahead.
No, I'm sorry, I interrupted you. Go ahead.
Oh, no, I was just saying, and then the other part is my only issue with the continuation of services plan right now is that it references levels that aren't being reported right now. It's a leveling system that the CDC has walked away from. So our whole continuation of services plan, I don't disagree with you. I'm not ready to walk away from, you know, the monitoring, but we have a misalignment between how the CDC is reporting on communities and how our plan is structured.
Yeah, the continuation of service plan is effectively non-existent at this point because it was replaced by the POP.
No, the continuation of services plan is a part of the POP.
Well, according to the latest version I have of the POP, it may not be the latest, I may not have the latest version. We say this document is intended to replace the continuation of service plan.
I think there's
I'm reading-
confusion over what we're calling. Vanessa is specifically referring, Marcia, to the page that has the 4 colored tiered levels.
That's
Okay,
different.
and
Yeah, that's different. Yeah.
yeah, and previously we had referred to something called a continuation of service plan within the document, but that had been,
Right.
you know,
Superseded.
superseded. Exactly.
Yeah, okay, so it's just semantics. We're all on the same page.
Exactly.
But
Can I
guess
just,
I
I just
yeah.
thought I would jump in here because Phil and I talked about this earlier today, and I can see he's joined the meeting. And I wondered if we might be able to make a suggestion that might address a couple of, you know, because we're the ones who really worked on this, you know,
Absolutely.
this new design. So, and this might address some of Mike's points to some extent. I mean, I know Mike is, you know, I know your feeling is whether or not we even need this altogether, but Phil and I wondered if we could quite simply align the 4 tiers to 3, because if you see, substantial and high are almost exactly the same.
Sure.
And if we were to make them aligned with the CDC's, you know, 3 tiers, then you could have the highest level. Almost everything under the highest level could be denoted as at the discretion of the library director. And so you kind of give, you know, some context to what, you know, that particular high level, you give an option, I guess, to sort of do what it is we're going to say we're willing to do, but at, you know, with an asterisk that says we you know, reserve the right to maybe tweak that or change that according to our own you know, inner decision making. But that way we'd really be able to retain this tiered plan and not completely throw it out the window, because I think it still serves a pretty important function communicating to the public and to ourselves, to staff, you know.
Yeah. No, I think that's fine. I think that's great, Maria. I mean, that was pretty much my point, was just that we have multiple tiers. The rates that correspond to them are transmission rates. Now we're at a leveling. And so I think the only other point that I would want to retain would be just,
Okay.
just 1 second.
Okay, bye, Mike.
Would be, I think that those transmission rate levels, associated levels, are valuable. So, you know, if we returned to that, so we're not constantly in this situation of having to like realign or translate the plan. And that could be, you know, as simple as the board or the president and the library director indicating that we're going to base our leveling on transmission rates because of the flare up or something, like, I don't know. And so just give ourselves the flexibility to sort of live in this in between because we just transitioned and we don't know if we're going back there. But yeah, I think that's a perfectly fine suggestion. And maybe it's just, you know, like you said, an additional row above it that has the different, the current levels of high, medium, low, the notation, some additional asterisks.
Yeah.
Okay.
Yeah, I'm all fine with all this. I think that that's very workable. And also kind of feeds into Mike's suggestion. My only question is, do we want to do it now or do we want to wait a little while? That's my only issue.
I think that I would recommend we do it now, just because the CDC is updating the community levels map, not the community transmission anymore.
Okay,
And so
okay,
it doesn't really mean anything if we're not using the leveling system. I mean, I think we can do the translation. So I don't know, Maria and Phil, if you're willing to, I mean, I think it's really straightforward. I could probably do it too, of the low, the medium, and then the high.
Yeah.
If there's some nuance there that you wanted to clarify, or a particular notation, it sounds like we're mostly in agreement. What I'll do is I'll go back and double check, because I don't think that authority, that the board chair and the library director that we agreed on as a board, we voted on it. I remember it was my first meeting, in-person meeting, and make sure that's reflected in the plan. That's all, just so that we didn't have to have the email back and forth or any questions of, can they do this, whatever.
yeah, I'm fine with all this, Marcia.
So
Yeah, I think it makes sense because, since the levels have changed, the plan should reflect what the levels actually mean now, which is something I think pretty different from what the levels meant before.
Right, yeah.
My only question is, and I know Albany County is still technically medium, but I was listening to the school board meeting the other night, and we're like a fraction of like a point away from being designated as low. One of the things that I think is interesting with this new leveling system is that the last update on the website was March 3rd. My guess is because it relates to hospital admissions and capacity, that the refresh on that data is a slower interval. But I'm curious, technically we are still medium. So I saw that you had the chart there handy, Maria. Where would that put us as far as services? Is that reflective of what you see happening in the library right now?
yeah, I mean, I think when Phil and I looked at this, like low and moderate pretty much matches low and medium.
Yeah.
It was the substantial and high that I think is pretty easily addressed. I think we have to take out some of these numbers, like where we say 50% indoor seating and 25%. I think you're going to want an asterisk.
Sure.
Wherever we have. So I think there's very little changes. I mean, I don't think it's going to be massive, right, Phil? When we kind of went over this, we felt pretty comfortable making some suggested changes.
I guess
Yeah, I think
to
that's
say another
accurate.
way, with the moderate, wait, hold on.
With the moderate?
Moderate equates to our current medium community level. Are you comfortable with what's represented there as available services?
Yeah, so let me just quickly look through indoor study room use, restrooms, indoor outdoor programs have an asterisk already. Limited meadow playroom use has an asterisk. Limited public meeting room use has an asterisk. Yeah, I think I'm comfortable with moderate sort of representing what we are now. Phil, what do you think?
I think that's accurate, and I think that's in line with what we discussed earlier today.
The only other the other thing to keep, a keen attention to there is that we are very close to being low.
I know.
I expect that probably in the next week, barring some flare up caused by spring break, or the universities have spring break around here, people are traveling. That would essentially mean no restrictions.
Right.
That gives me a little pause. I mean, I know at some point we have to take that step forward. I don't know if I'm ready for that next week, but that's what this change would mean.
Yeah, but that's why I talked about, a little bit of lag time, but.
We did before talk about changes to the level of continuation of services coming after a sustained period of time being at a level. So I guess that, and does it say it at the top? Is it like?
No, it doesn't say that any
I
longer.
apologize that I don't have mine.
No, we took that out.
We did?
Yeah, it doesn't say that in this one. that the event during periods of moderate or higher community. Well, maybe I'm wrong.
No, I thought that when you were switching between levels, it had to stabilize, because I remember us talking about that. Do you remember that, Marcia?
Yes.
Well, I don't know.
Was
I'm
it-
looking at
was
the most recent printout.
Was it 2 weeks?
That's what I want to say. I'll take a look. Let's talk about it now. This presents an opportunity for us to clarify or revise.
You know what it has, Vanessa? You're absolutely right. It says this plan provides for general guidelines on movement between phases. Library director will move between phases when CDC transmission rates have shifted and remain at the new level for at least 7 consecutive days.
Okay.
Oh, it's 7 days. Okay, not 2 weeks. Okay.
So the only thing that I'll say about that is, given the refresh rate of this data, I don't know. What do folks think about that? Are you comfortable with 7 days? Would you like to see it be a longer period? I'm asking library personnel because you're the ones who are, you're in the building.
I kind of wish it were 2 weeks, I think.
Well, I think I talked about 2 weeks at one point. Yeah.
And there are less levels now. So I think that there could be an argument made for that. So why don't we recommend that change along with the 3? Natalie, were you trying to get in there? Was that your?
Yeah, I don't want to open a can of worms by saying this, but do we have to state a time limit? Can it just be at the discretion of the director?
I think we could, but with any of these, my reasoning for always having a little detail to it is that it gives the library staff some cover of like an explanation that you can point to. It's visible. It's, you can anticipate it. But I'm open to hearing arguments otherwise.
Yeah, I like a time frame. I think that it's important to have something in there that gives some guidance in terms of time frame before you shift. And I also think, as a matter of public policy, it makes sense to have a time frame. It gives some guardrails to the staff, and I don't think it's unreasonable. I mean, if you wanted to do 10 days, 2 weeks, I'm okay with that. But I think it's important to have it in the plan.
So does it not work the other way though? Like if the level, I understand if this level goes to low, then you give it 2 weeks, and if it's still low, then basically operations are normal. So, but if it goes the other direction of it's low and it suddenly goes to medium, I
do recall.
Is it 2 weeks again, or just?
No, I recall that we had a difference. And if we didn't articulate it, we should, because I definitely recall this conversation. The time was more conservative, a longer ramp going down, but gave us the flexibility to implement changes quicker if conditions worsened.
Right.
To me, it should be immediate, I mean, because doesn't the CDC and or the county do it based on an average anyway? So it's already built in that there's been a little transitional period. So if you're traveling in the direction of more medical danger, I don't see any reason to wait,
Yeah, I'm okay with that. I can take a look at it and send some language around to everybody. It's just the few sentences.
Yeah.
And then Maria and Phil, if you want to just take a look at where you want to add some asterisks, just highlight it. So at this point, we can kind of see where the changes are.
Yeah, I think what makes some sense is maybe we can snag Natalie and Tim for a quick discussion on that, just so we're all on the same page from the library staff standpoint, and be able to, make some changes to this.
All right. So if it's going down and we're hitting low, I just want to understand what we're saying. If we're at low and suddenly something terrible happens, we want the library to be able to adjust to that quickly, right?
Immediately.
Yeah. Yeah.
But if we're going to relax or reduce restrictions, we want it to stabilize before we make a movement. So we're saying,
Right,
let's
and-
just decide right now, what is, raise of hands, who prefers 10 days? The other choice is 14.
14.
14? Okay, 14
yeah,
days it is.
I'm okay. Yeah.
I
I
guess
think
my
on this.
question is, I just have one question. Like, I think that some of this new guidance is confusing to people. I mean, to say, you know, just almost like a, you know, it's obvious that it's confusing. And if the library, say, were to keep switching between, now there's a program and now there isn't a program, and now we're canceling this and now we're having this, and I don't know. I mean, you might want to think about what could really stay if you went back, if you were low and then you went back to moderate. Do you cancel a lot of things? Do you
No.
tell
So
people I mean, I'm not, I guess I'm not really sure, because it, like I said, it's very confusing. It's almost like the guidance has almost become almost like individual, like what do individuals want to do? You know, do you want to wear a mask? Do you want to not wear a mask? Do you want to keep apart from people? Do you not want to keep apart from people? I mean, the CDC is not helping us out very much anymore. So, I mean, I guess that's just, there's just a question as to switching between levels in terms of
Yeah.
what will that actually look like?
So what I think though is, I think if you look at that chart, most of the programming decisions are at the discretion of the director. So I don't think we run the risk of moving levels and then it's automatically canceled, right? Because I think it's going to depend on the condition that changed, what the circumstances are, and that's why we need actual people to use their best judgment. And I think that's why having the asterisks for like programming is important. The other stuff I think is a little bit easier to quickly shift on, right? And then we're just using the chart as a communications tool to the community so that they know what kinds of changes to expect. I don't disagree with you that the CDC is not doing us any favors here, but I'm not ready to just make the distinguishing factor between the levels of purely personal decision in the library. I just, it feels too soon.
Yeah, I agree with that.
Well, the one
I
thing I
think the
would,
problem, yeah, go ahead, Tim, I'm sorry.
the one thing I would add to that is that I make very few decisions without input from senior staff. So, in fact, I probably never have made any except for whether to close for the
Yeah.
snow. But
Yeah.
anyway.
Yeah.
We
Yeah.
don't
I mean,
we don't make very capricious and
right.
crazy immediate changes. We do really try to spend a lot of time talking about like the wisdom of, you know, moving into one phase or another. And a lot of times, Kathy, some of our decisions are made for us by the presenters themselves. So you have to realize that that's an unavoidable, you know,
Yeah.
aspect of all of this. That's an added, you know, factor that
Yeah.
we can't always dictate. So, you know, it's
Right.
again, these are not these decisions to sort of go from, you know, no programming to some programming to all programming, and then in the reverse direction aren't made capriciously, you know.
Right.
Nor do
I
they.
think
I
the
wouldn't
No,
think that
go
they
ahead.
would be. I was just saying, that as far as individual choices, and also probably some of the library's choices are made just a little bit more complicated because of the new guidance or lack thereof. That was my only point. I just think it
Yeah.
it makes your decision just more difficult. You know?
It was difficult to begin with.
Yeah. But now it seems like it's even more
Yeah.
challenging because you're not sure what to do with this guidance, and
Well, you have a point there, because I will say that, you know, I was listening to a report this morning about, you know, the fact that without, you know, vaccines yet for children 5 and under, I mean, the no masking all of a sudden is really a major concern for a lot of families with very young kids. So,
Mhm.
you know, that, and where is the guidance on that? We're not being told, oh, don't have programs with young children. You know, it's,
Right.
so that's a very tough situation for us, you know.
And actually, Maria, that makes me, my sort of kind of final thoughts on this today is that it sort of solidifies for me wanting to keep some sort of protections or levels in place, because we did remove masks and make that an individual decision, and we heard very clearly that that wasn't really the favored choice by some patrons. And so if we're going to really keep the interest of everyone in mind, like, we do have a responsibility to have some process or procedures in place that offer some sort of reassurance or protection for those that are not that thrilled or on the side of let's throw out the masks. And so I think it's a compromise. And I also think it's going to be really important in like the meadow, right? Like, do we really want to allow and encourage people, whether it's their personal choice or not, to have infants or toddlers crawling around the playroom if we go back to a high level? So.
Right.
Yeah, yeah, yeah. Look, we're trying to impose some guardrails
Yeah.
and some logic to what is essentially a confusing and sometimes chaotic situation.
Yeah, and allow
And so,
everybody to feel a little bit of comfort.
yeah, yeah. And I think, you know, the mask mandate that we put in place with this recommendation that people wear masks is probably the best we could do. You know, as Tim said, he wears a mask. I wear a mask every place I go indoors, regardless of CDC. So, but we also need to have some discretion within the library staff and the director. So we're doing the best we can in a situation that we really don't control. And I think we've done pretty well.
Yeah. All right. Anybody else have any other thoughts or comments, questions?
Do we, is there, the fact that the POP specifically says masks are required?
I'll go in and I have on my list 2 things to do. Update the language around masking and make sure it includes sort of the discretion and authority that had already been decided. And then clarify the language around movement between
Perfect.
the phases.
Okay.
I was just looking that next week is our meeting. When are materials due, Tim?
I think that she sends the packet out on 7 days before, so it would be either close of business Wednesday of yesterday or today. So we can always send it out supplementally, you
Okay,
know.
I'll do it as I'll do it as soon as I can before
Okay.
the weekend so that we can
Yeah.
get it out to folks. This is not something that has to age, so we should be able to take action or a vote on it.
So Vanessa, you know, I feel like almost embarrassed suggesting this because you're very organized and so forth, but for the benefit of the board members not with us, if you just had a bullet point list of the changes, that's really all they need to see. I mean, they can obviously get a copy of the whole new plan, but that's where
We
their
have some
questions
board
would be.
members who will want to peruse the whole plan and point out my typos or other things that I missed, so I won't deprive them of that chance. So I'll do both, Tim. I'll do
Okay,
both.
thank you.
In terms of the chart, Phil, are you at work tomorrow?
I'm not, but I can work on the changes today and I'll add them in as track changes for everyone.
Yeah, and maybe, I mean, I'm not there right now. So maybe you can just touch base with Natalie and Tim, but I think very much what we kind of discussed today makes sense. So
And what might make sense, Phil, do you leave at 4 today?
I do, yes.
Natalie, aren't we both free at 3 when this REC, are you free at 3, Phil?
I can be, yes.
Okay, why don't you drop by and we'll do it then? Okay.
thanks.
And
The levels that you'll change, and then also an eye towards any additional
Asterisk.
discretionary decision points.
Yeah.
Okay. That was easy, relatively painless. Thank you so much, everyone.
Thanks a
Thanks,
lot,
everybody.
Vanessa.
I'm sorry.
Oh.
I'm sorry if I missed anything because I was in and out of the call, but was it discussed or is it somewhere in there when we can resume meetings in person for
That
the
isn't
board?
part of the POP, our decision to meet in person as a board, you mean?
Yeah.
I think that that was multiple factors that weren't completely related to the POP. Am I correct in my, or were we withholding from meeting in person because of the services plan? As a board.
Are you, I'm sorry, are you asking me? Because I'm
Well,
not
I'm
sure about that.
asking the group and people
Oh,
look
okay.
like they're thinking. I'm sorry, you don't have the benefit of seeing the facial expressions.
Oh, yeah. And I also don't have the document in front of me, so I can't review it. But I'm only asking because I was also part of the foundation meeting and they had wanted to use the facilities for their meetings as well. And they were wondering if they could meet in person at the library. And I was wondering if we could also meet in person at the library, or is there something that's stopping us from doing that?
No, it's a great question.
Well, in the moderate or medium level, limited public meeting room use is allowed, is at least in this plan. So I don't know whether there was any other sort of mitigating factor within the board itself. Maybe Kathy knows of whether there were people who didn't want to meet in person. I don't know what your rationales were.
I haven't taken any polls about that. So I know that,
Yeah.
Tim, you mentioned that there were some materials in the boardroom.
There
So-
are at the moment. My suggestion would be, we can move things and make a space available, whether it's the Helderberg room or the boardroom. My suggestion would be to just obviously, get opinion from other board members, but to hold the March 17th meeting virtually and essentially at this moment, essentially plan to hold the it's like April 28th, I believe. We moved it because of the school break week. So it's 5 weeks after this one. And I hate to say, assuming COVID continues to get better, but indications do point in that direction. So it would seem reasonable to just sort of plan to have the April meeting in person and then, maybe bring it up under new business on March 17th and see if anybody has a concern, or else I think you could get away with an email to the board members. Does anyone have a concern with holding the April meeting in person? I don't think that's really board business.
Yeah, Maria, by April 28th, would you be able to have virtual and in person, or that the learning curve is still?
I don't know. I can't answer that. That's a question to ask IT. Yeah.
And I can answer it. Yes, I mean, we could do it tonight. The equipment's all in place in the Tower Center room. We just have to move the crap out of it, pardon my French. So
does IT know how to operate it?
yeah, they do. We've tested it and so forth. So for a board meeting, we can do that. In terms of the programming questions, that's a different question because it's a different array of technology.
Okay, so if conditions continue on April 28th, we could have an in-person meeting, and for those people on the board who are not comfortable, they can join virtually.
That is true, and I'll double check that with Sean after this meeting.
Okay, that's good.
So we can put that on.
That was a really good one.
Yeah. Well, I know that some other board members had expressed wanting to meet in person, so I just wanted to make sure that we addressed their concern, and I would not be opposed to meeting in person. Obviously, next week is too early, but if we could at least mention at the board meeting that we talked about it, and maybe we could take a vote at the board meeting as to, what people are wanting to do.
Kathy, would you let me know either now or later whether you want that on the agenda under new business before Jenna sends it out?
Sure. We could
Okay.
we could put that under new business, and I don't know if Jenna sent it out yet, but we could always send an addendum.
Sure. Or, several board members here, somebody could just bring it up, because there's always that call. Does anyone else have any new business they'd like to discuss,
Sure.
Okay.
All right. Very good.
Good question.
Better.
All right, sounds good. Thank you.
Thank you. Thank everybody. Thanks, everybody.
Marie and Phil, will you send me just a copy of the change, the updated table when you have it? Or whatever. It sounds like Phil might have it.
Absolutely.
Okay. All right. Thank you. And then I'll share with this group.
A quick note for Natalie and Phil. I can't look at my schedule right now because both screens are involved with streaming, but I think our meeting, Natalie, ends at 3:30. I think we have the programming portion at 3 o'clock or at 2:30, and then the wrap up from 3 to 3:30. So maybe we'll confirm that and check with Phil offline.
Are you free right now, Tim?
I'm not really. I've
You're
got
not,
another
okay.
thing in 3 minutes.
Yeah, I'm going
Oh,
into
okay.
I'm going
Got
into
it.
a webinar at 2.
Okay.
Yeah. Okay. So are we all set, Vanessa?
Yeah, I think that's
Okay.
it.
Thanks,
Thanks,
everybody.
everybody. Great
Bye-bye.
meeting. Bye.
Thanks.
Bye,
Bye.
everybody.